And welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Peer Personnel Training and Placement Program Informational Webinar. Here's the agenda for today's webinar. Do some housekeeping and introduction at the beginning, followed by a welcome and overview. From there, we will talk about the Peer Personnel Program, followed by questions and answers. We will open up the chat for those, and then we'll have some closing remarks, and that will be all that we're doing today. Lastly, before we begin, I would like to discuss a few housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the camera, microphone, chat, and view controls in the menu bar at the top of your screen. Chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And the webinar will be recorded and available within 7 to 10 business days on our website. And with that, it is my pleasure to introduce Wahida Nawab, Grant Section Chief for Health Workforce Development, for our opening remarks.
Thank you, Chris. I go to the next slide. Wonderful. Thank you. Thank you, everyone, for joining us today. Just want to go over HCAI's vision and mission. Our vision is a healthier California where all receive equitable, affordable, and quality healthcare. And our mission statement here is HCAI expands equitable access to quality, affordable healthcare for all Californians through resilient facilities, actionable information, and the health workforce each community needs. Right. HCAI's program areas: facilities that monitor the construction, renovation, and seismic safety of California's hospitals and skilled nursing facilities. Financing: provide loan insurance for nonprofit healthcare facilities to develop or expand services. Workforce: expand and diversify California's healthcare workforce to address disparities. And the data that we collect is collect and manage, analyze, and report actionable information about California's healthcare landscape. Affordability: improve healthcare affordability through data analysis, spending targets, and measure to advance value. Enforce hospital billing protections and provide generic drugs at a low, transparent prices. HCAI Health Workforce Approach and Strategy. HCAI enables the expansion and development of a health workforce that reflects California's diversity in order to address supply shortages and inequities by administering programs and funding and generating actionable data. Develop, support, and expand a health workforce that serves medically underserved areas, serves medical members, represents the California it serves through racial and language diversity. Offer programs that provide financial support for organizations building the workforce pipeline, organizations expanding educational capacity, individuals pursuing health careers, and organizations supporting providers and addressing retention. Our 4 areas that our programs focus on is behavioral health, nursing, primary care, and oral health. Now I'll be passing it on to Clinton Ramstad to go over the peer program.
Thank you so much, Wahida, for the introduction. Good afternoon, everybody. My name is Clinton Ramstad. I am the program manager over the peer program here at HCAI. I'm going to start with a brief recap of how peer has worked in the past in HCAI, and then also how it's going to continue working at least through this 2025 cycle. So remember, peer these are funds for public, private, and nonprofit organizations, including faith-based and CBOs, for training and support that facilitates the training and placement of peer personnel. Peer personnel are individuals with lived experience as a mental behavioral health services consumer, family member, and/or caregiver placed in designated peer positions. Applicants must provide training to peer personnel that meets the 80-hour training requirements under the DHCS Medi-Cal Peer Support Specialist Certification Program. Currently, the way the program has existed and will still work for 2025 is that there's no service obligation for this program. Next slide, please. Right. So this is a quick and easy view of how HCAI has funded peers over the last 10 years. Please notice that we've had years in the past where there's been less money available. If you look at it, you could see that earlier on that we were a little bit more closely aligned with a $2 million cap. When we had extra funding, our organization would allot that extra funding to help support the peer program. These last 3 or actually 4 years, we've had a little extra money to spend on it. And so in the next slide, I'll show you how that works. Next slide, please. All right, in these last 4 years here, we've supported peer primarily using CYBHI money. And we were lucky enough to have it. There is a little bit left over, but the plan for this year is that we are going to spend the last of it, scratching the bottom of the barrel, using up all the remaining funds that we have for people who haven't finished using all their funding, people who haven't completed all their program deliverables, and any other money we can find if we can. So that's where things stand right now. So the main thing I want to communicate is that our CYBHI funding to help strengthen this program is basically running out this year. Next slide, please. This is the fund that our MHS funds are the funds that we're allotted for this program every single year without exception. So we will have this year, next year, and for future years going on and on and on until I don't know when. But we get this every single year. It's just a matter of whatever extra money is that HCAI has to pull it from other funding sources. Next slide, please. All right. This next topic is hopefully going to be a little bit more helpful to you, a little bit more optimistic. In this next year, we were given the opportunity to draw upon some BH Connect money. It's called the BH Connect Workforce Initiative. And the Workforce Initiative will support the training, recruitment, and retention of behavioral health practitioners to provide services across a continuum of care. Between 2025 and 2029, in partnership with the Department of Healthcare Services, HCAI will invest up to $1.9 billion in 5 workforce programs. Recipients of workforce funding will commit to serving Medi-Cal members living with significant behavioral health needs for 2 to 4 years. The state may carry unused workforce initiative expenditure authority from 1 year to the next. After demonstration of year 2, the state may redistribute up to 30% of workforce initiatives fundings across the programs. Next slide, please. So these are the 5 core programs that will be impacted by the BH Connect workforce. Medi-Cal Behavioral Health Student Loan Repayments, Medi-Cal Behavioral Health Scholarship Programs, Medi-Cal Behavioral Health Recruitment and Retention Programs, Medi-Cal Behavioral Health Community-Based Provider Training Program, which is chiefly what will be the primary engine for peer moving forward, this one here. And then the last one is Medi-Cal Behavioral Health Residency Training Program. Next slide, please. This right here is how these are the rules of the guidelines that we were provided on how we will conduct the funding. And so this is the explanation in detail, and then we'll go over this point by point in the next couple of slides. So, and you'll have opportunity to review this more carefully when we make all these slides available to you. We will post them up to the website. Next slide, please. All right, so in order to become eligible for the funding for the BH Connect, okay, there you will have to put your participants in a training site that complies with these requirements. The training site will have to be an FQHC or federally qualified health center, or a FQHC lookalike, a community mental health center, a rural clinic, or a hospital setting that meets a Medi-Cal payer, a Medicare or Medicaid payer mix, which can be 40% for non-rural, and it stages down depending on the circumstances. But they will have to serve in a setting for up to 3 years in a training site that meets these criteria. Next slide, please. Oh, actually, well, if we could go back one slide here, I'm gonna offer you another helpful detail. Okay, HCAI does offer a geo website, and that's it's on the geo.hci.ca.gov website, where you have the current functionality is that you can look up FQHCs, FQH lookalikes, and rural centers. Okay, HCAI is looking to expand the geo to see if in the future if it can allow for a broader capability of capturing some of the other things like the community mental health centers or possibly the payer mix. I don't know how that's going to play out. We have really wonderful people working on this, seeing if they can expand its capability. I just wanted to throw that out there so that you're aware of this as a resource in case you don't know where to find this information. Okay. In addition to that website, we also have different places that we could go to find this information too. But this is a resource for you to use should you choose, if you want to see if a particular site is viable or not. All right, now we'll switch the sides. Next slide, please. All right, so in terms of BH Connect money, the funding will be made available to HCAI after July 1st, 2025. We anticipate running our first BH Connect community-based provider training program cycle in early 2026. The state may pay up to $10,000 per participant. For your purposes, we'll say participant. Here it says practitioner, but per participant. Participants may serve up to a 3-year full-time commitment of service in a safety net setting. Safety net setting is that criteria we just mentioned in the previous slide about the locations, the FQHCs, FQH lookalikes. So if you're wondering what the safety net setting is, that's what it means. Payments must be made directly to the training program on behalf of the practitioner, and funds will not be provided to individual participants. Next slide, please. This right here is an outline of how much money we have to draw upon for the next few years. So we're going to have funding year over year. Now, when you apply for this, when the BH funding becomes available, there will be a 3-year commitment, and so there will be a slight impact on the last possibly year or two on how we arrange for that, so that we can make sure that we can pay all the money that we need to pay in that 3-year commitment. But this is how we are allotted the money as an organization. Okay. Next slide, please. These right here are some helpful links on if you're going through the process and applying for your peer cert application right now. The bottom two, so there's the first 5 links is we have the grant guide, the technical assistance guide, the link to the application, and then below that we have the link to the DHCS peer support page, and then also the Cal MHSA page. Where you can see if your program is eligible according to Cal MHSA. And then finally, we follow up with a link to our BH program mailbox. And so if you have a question that wasn't answered today, you're welcome to send your question to the BH program mailbox, and we'll be happy to get back to you as soon as we can. Let's see here. The last thing I want to do is you've heard about the impacts of funding that we had to this year, but I would highly encourage you to apply anyway. Don't let that dissuade you from applying for this program. Our upper management cares about this program, and they would like to see if there's a path to find some extra money, they would like to throw it in there. Moreover, if you apply for this program, it provides HCAI with an opportunity to highlight or show the legislature the demand for the program. And so even if we don't have the ability to fund all of our applicants, we really encourage you to apply, because it's helpful at the very least to demonstrate that we have more demand than we have money to supply for that demand. All right, next slide, please. And that concludes my lecture there. And we're going to go back to Chris. And thank you so much for listening and participating. Have a great day.
Thank you, Clinton. We appreciate it. As you can see, our team has been putting a lot of hard work into this program, and we're excited that you've joined us today to learn more. This is one of the programs that we're always excited about, and we're going to transition into our question and answer session. The chat option should be accessible now and in the menu bar at the top of your screen. We do ask that you use those chat. If you are unable to use the chat, go ahead and if your communications preferences of your organization do not allow you to access the chat, I should say, you can go ahead and raise your hand. That way we know that there are some of you out there. You can always email us at bhprograms@hci.ca.gov with anything that we don't go over today, or if you have follow-up questions from there. We're going to try to answer all of the questions that we get to today. We'll order them in the order that we receive, and we'll try to get to everything we've got. So let's go ahead here and go to our first question. And I see Anna is asking, how many organizations are you looking to award?
This is Clinton. We have enough funding. We have the $2 million in funding secured, and so that would allow for the opportunity to award. Typically the awards were up to about $1 million per organization, so we can absolutely guarantee awarding 2 organizations without question. More beyond that, though, we can't make any promises. But our upper management is looking for money and seeing if there's extra money to try and provide that. I hope that helps.
All right, thank you. Next question, Stephanie Ramos. Good to see you online, Stephanie. I remember meeting you at the thing that we did earlier this year for behavioral health. What happens if someone is unable to find employment in a peer role? Some counties have very limited peers, 5 or less. What about the impact of Prop 1?
We will probably we're still discussing how to implement the behavioral health program, the BH Connect program, and so that may be something that we'll need to consider is a possible waiting period. If it takes you time to secure additional employment, or if you lose your employment, how long do you have to jump into the next employment? At the moment, I don't have an answer to that, but it is being looked at right now by our upper management.
Thank you, Clinton. Hi, everyone. This is Charmel Shaw, Branch Chief for Behavioral Health and Policy. I will add that we are working to include job placement support as part of the BH Connect program, very much like our current program. So that is something that we are considering.
All right, thank you, Charmel and Clinton. Anna asks, will you consider the pass rate on the exam as a measure of success?
Well, it is a measure of success. Getting your certificate is a measure of success, but in order for the purpose of the BH Connect funding, though, beyond that, the participants will need to gain employment and then also serve in that employment for up to 3 years. If they complete the 3-year service obligation, that is what we would consider success.
All right, thank you, Clinton. Stephanie asks, what happens if someone is unable to fulfill their service commitment due to a disability?
That's another one of those questions that we're still chewing on. Our management is evaluating, because just like similar to the problem of what happens, in the transition period between when you're out of employment and trying to get back into employment, or you're waiting for it. It's another one of those questions that they may need some time to work on. So I don't have a good answer for you right now. Sorry.
Thank you, Clinton. I'll also add a few thoughts here. We have heard, and I really appreciate the question. This has come up in several conversations, and so we are working directly with the Department of Healthcare Services to really understand what our options are and what flexibility we can provide. As you may know, CMS has put down these conditions in which, at the moment, are not negotiable. But we are, like I said, we are having a conversation with Department of Healthcare Services to understand what our options are. So we will definitely keep you posted.
Right. Vicky asks, are you looking to fund new organizations or are you permanently reawarding previous, or primarily, primarily reawarding previously funded organizations?
Clinton, again, this is a competitive process, and so if you we offer the scoring criteria in our grant guide if you're interested in looking at that. So the organizations that score the highest are more likely to be eligible for an award. And so, but we try to, as close as possible, stick to our scoring criteria that we have on our grant guide. And we will provide the link in the chat and then also the link in this presentation. So when you're ready for that, you can see it. It's also up currently on our website right now, hci.ca.gov. Thank you.
All right, thank you. From Stephanie, this seems very inequitable. Scholarships of $35K have a 12-month service commitment, but this training has been priced at $1,600. Why would people sign up for a 3-year service commitment for this small amount that they don't even receive?
Charmel, would you like to answer or help with this?
Yeah, I think I'm not quite understanding the question about the 1,600. Where does that come from? I'm sorry. Is that a
I believe they mean the $10,000 amount per participant that the new BH Connect funding is going to offer.
Oh, okay.
And it contrasted against I think it was the $35,000 scholarship opportunities that are being offered right now.
I see. Yeah, what I can say about this, and I can also take the question back to our leadership, but what I can say is that we had been in a back and forth conversation with CMS on the terms of this particular program, and this is where CMS landed. So I can't say anything more than that, but I will take back this question. Is this question, are we able to keep this question, Chris, in somewhere where I can take it back? You're on mute.
Can you hear me?
I can now.
Okay, that was weird. Yes, we can capture that.
Okay, thank you.
Thank you so much, Charmel. I appreciate it.
All right. This is from next question. Related to Stephanie's question, some counties like Imperial County use other titles for their peer roles. For example, mental health tech, mental health workers, etc. Would these be considered successes?
So consistent with our grant guide, though, we still need all of the participants to complete the 80-hour DHCS course and get the certificate, and then serve in that capacity as a peer participant. If it goes by a different name or different title, that as long as it's serving the same function, it should not be a problem. Because I know other organizations will use a different name sometimes to do the same thing. So as long as it's consistent with what's outlined in the grant guide, it should not be a problem.
All right. The next question. If several organizations achieve top scores, how will you determine which one is awarded?
Well, when we get to the point where we make award recommendations, we usually present them to the upper management and allow them the opportunity to evaluate it. So we top scores, so in the order of operations, we'll go score from highest to lowest. If in the case that there's a tie, then we'll take into account other factors, which could include geographic distribution of training sites, or possibly efficiency and how one program can train a participant more efficiently than another program. We may have to look for other means for a tiebreaker if and when we're in that situation. But HCAI tries very, very hard to do the process fairly and equitably.
All right, thank you. Stephanie asks, for the BH Connect funds, who is responsible for the funds, the individual or the organization? And then who is responsible to pay back the funds if someone does not find or keep employment?
These grant agreements are made between HCAI and the peer program organization. So the organization will be responsible for the monitoring of the peer participants and ensuring compliance.
We did get a clarification on the earlier question. The 1,600 is from the Cal HMSA DHCS scholarships for those training, and I understand the programs will be funded at a higher rate. So that was what where the 1,600 came from. All right. Next question. May you please give examples of additional peer training that specifically addresses the needs of consumers 0 to 25 years of age and their families?
Well, many organizations have different ways of how they conduct their peer program, and so some of them may help with substance use disorder. Some of them may help with mental disorders, but that's the hope, is that they will specifically target youth, 0 to 25. The target group that is being helped or assisted by this is the youth 0 to 25 years of age.
All right. And there are many private orgs that serve Medi-Cal recipients. Do those type of orgs count as placement and partners?
I would say, going back to what Clinton described on the eligible sites, that as long as they meet the Medi-Cal threshold, I believe it was 40%. And then I think for rural hospitals was 30%. Clinton, can't remember, but I believe that's the actual number. So if they serve Medi-Cal, they just need to make sure they're in that threshold.
All right, thank you, Charmel. Jason asks, are the eligible sites hiring peer specialists? How many open positions do you foresee across all eligible sites?
Clinton, we don't know the answer to that. Usually, the peer organizations are the ones who they help secure training and placement for these people, and so the organizations will know the answers to this. This is not something HCAI handles. We just we allot the funds, and then the hope or expectation is that the organization will perform these services for us as part of the agreement.
Right, thank you. Stephanie asks, is it correct that this is only available to people who can work full-time in their service commitment, meaning that part-time employment would not count even if the limitation is due to disability?
Well, just to be clear here, there's two different distinctions. There's how the program currently exists, and then what's going to happen in the future. So the BH Connect money is going to be for 2026 and beyond. And the criteria for BH Connect does require a full-time service commitment, okay? But taking into account disability, our upper management is still working out the details for that. So I'm not in a position to comment about how the impact of participants who are experiencing disability, how they will be handled in that situation. So I apologize, but I can't help any better with that.
It's certainly helpful that we have these question answers to be able to discover issues that are out there for inform us on these things. Jason asks, are the eligible sites hiring peer specialists? How many? Oh, wait, we already answered that one. Sorry, I got lost on my list. Here we go. As a follow-up to the question about training to serve youth, it sounds like that would be included in the curriculum trainees learn, or is it meant to be additional support for trainees?
One of the things that's wonderful about this program is a lot of our organizations who are awarded, they provide additional training that goes above and beyond the required DHCS certificate requirements. And so hopefully, the organization will provide those additional help and resources because for our part, we welcome it. We're grateful for the extra work and extra effort because but the 80-hour DHCS course is kind of like the minimum threshold that's expected. But many of the organizations we partner with do provide above and beyond that. But it's not it's not exactly the same for all of them though. Some do more, some do less.
All right. Let's see. Next question from Elva. Peers may be already employed in a peer level role, however, need the certification and assistance to retain the employment. Do they qualify to apply and participate?
I'm sorry, Chris, could you repeat the question? I didn't hear it correctly.
Peers may already be employed in a peer level role, however, need the certification and assistance to retain the employment. Do they qualify to apply and participate?
Well, I mean, so long as it's not in, I guess the thing is as long as they've not been a recipient of a previous peer funding award. Currently, the way the program exists is that our organizations can peer fund. They're funded for up to two years, and so if they fund a peer, and then later, if they go into another application, another agreement down the line, they could possibly do that again in the future if that peer wants to serve in another capacity in the future. But just in their current grant obligation and current term, that it would be inappropriate if they were funded in the same grant agreement.
All right. And always on these questions, if we don't get to the full extent of the questions or you have follow-on questions, remember it's tomorrow and you say, oh, what about this? Please email us at bhprograms@hci.ca.gov and we'll always be happy to answer your questions that way as well. Next question from Libby. Will BH Connect be available only for trainings that offer Medi-Cal peer support specialist certification training?
At the moment, that's as I understand, that's all that is being allowed right now. But I don't know. There may be the possibility that could be expanded to some other criteria in the future. But as far as I know, it's going to be the same right now. How that works when we move into BH Connect. So it was still required to do the 80-hour DHCS course and then also jump on the eligibility list for Cal MHSA.
And I will add, thank you, Clinton. I will add that the STCs, which are the special terms and conditions document that outlines all of the requirements, is that the state, meaning us, we will have to ensure that all education and training programs are certified or accredited by the state or organizations recognized by the state. So that is something that we'll be utilizing as we move forward with the BH Connect funds. So if Cal Mesa's program is one of those, then yes, but any others must ensure that they are certified or accredited.
For that clarification, Charmel. Next question. What is an example of an ideal number trained over the 2 years?
In a typical award year, based on the current and previous process, our expectation is that you'll be training at a rate of about $5,000 per participant. And so the expectation is if we award you, our maximum award is $1 million. So if you get the maximum award, then that'll be the hope, is that you will at least train 200 participants for us. 200 times 5,000 equals 1 million. So, but if you can do it more efficiently, if you're in a position to train more efficiently, especially here for this 2025 cycle, I would recommend putting that forward, though, because we were asked earlier about the possibility of being in a situation where we have to do tiebreakers. That might help with a tiebreaker. Okay, if you could train more efficiently than another program. I'm not saying that's what's going to happen, but just putting that out there.
All right, thank you, Clinton. Next question, for the evaluation component of the grant for Medi-Cal peer support specialist training, the grant guide says it should include comprehensive survey of program participants and their employers. Can you give an example of the data points you expect to be collected?
Absolutely, I'd be happy to. So things what we're looking for our peer participants. We need to know that they were trained, that they were placed, that they were recruited, that they were supported. Also, too, we collect the information, like if their race, ethnicity, sexual identity. We would collect those kind of questions as well. And then this year we're going to also be collecting the certificate information for their DHCS certificate information. So those are the kind of data points that you will be looking for.
All right, thank you. Question on the surveys. Do those surveys need to be anonymous?
Well, there's an organization, when an organization that is in charge or helping their peer participants, it will not be anonymous between their participants and the organization, but it is anonymous between the organization and HCAI. If personal information does not transfer beyond from the organization that the peer participant is working at over to HCAI. What happens is the organization will de-identify their information when they send it over to HCAI, and for our purposes, we just need the higher level of information, so we can look at the data and the larger picture. How many people are in this circumstance? How many are in that circumstance? And that's what we're looking for, to make sure our deliverable objectives are satisfied. Hope that helps.
All right, thank you for that clarification. Let's see. Next question. When do training programs receive payment in the BH Connect round?
Payment details. I'm sorry.
Go ahead, Clinton. Go ahead.
I didn't have anything new to add to this, Charmel, but if you do, please, by all means.
Yeah, it kind of depends on when the actual cycle is launched. We're looking at April is to launch the cycle in 2026. So then a few months from that date with the whole process to go through. I don't know, Clinton, if you could describe kind of how long it takes to score and do things so we can sort of extrapolate, but it won't be till after April.
All right, thank you, Charmel.
Oh. Yep. As a distinction, the payments for this year will be the first batch of payments will probably we usually align our awards to start on July 1st, and so probably the first for 2025 awardees, they would probably expect their first payment somewhere in October, because they have to do their first quarter of the service obligation before they're eligible for their first payment. In terms of the BH Connect, discussions are currently underway of how the money is going to be turned over to the organization and how that's going to be funded over. Because remember, there's still a 3-year service obligation. How that will be funded, if it's over the course of the entire 3 years, how it will be spread out. I don't have an answer to that yet, if that's what you were looking for.
That was the clarifying comment. Is when in the contracting period do they receive the funds? When do agencies get paid for placement?
Every one of our peer organizations currently, the way it works is that there is a quarterly certification And an organization will have 30 days to complete the quarterly certification outlining the work they performed in the last quarter, the 90 days prior to that, and then they'll be paid promptly upon submitting their certification.
Thank you. Let's see. Mo, did you have something to add to that?
Sorry, yeah, I just wanted to add something really quickly to that. So, because I'm the main person who handles payments. So Clinton was right about the October period. So the October period is the reporting period, the first reporting period for that grant year, for this grant year. And it typically begins from the first of the month to the end of the month. So you have that time frame from beginning of the month to the end of the month to make that report for that a specific quarter. It is advised to do it early, not wait to the last minute, because the longer because I like to work ahead of time. So if I get your payment at the beginning, if I get your report at the beginning of the month, then I can process it faster. That indicates that you will get a payment faster, or maybe by a week or two. But if you send it by the end of the month, and we can understand if you do that, you may be still collecting data. But if you are able to do that at the beginning of the month, it is suggested because I can probably make the payment much faster to you guys.
Appreciate that clarification, Mo. Mo is our program officer for this. All right, next question. We have started getting requests for the interpretation from individuals who are non-hearing. Presently, our organization pays for the interpretation's costs. During this present funding cycle, are there plans for HCAI to make ASL interpretation available for training organizations at no cost to the training organization?
Clinton here. That would be up to the organization, because HCAI contracts for the work, and if the organization is able to perform the work, that it would be wonderful. It would be our hope that the organization puts themselves in a position to do that. But HCAI doesn't do the training itself. We make an agreement with the organization to do the training for us. So that is our hope, that the organizations would be able to make themselves to offer that type of service, as part of the service that they're offering to the participants.
All right. Did want to check and just make sure that if there's anybody that does not have access to the chat feature. We've had lots of great interaction and questions today, and we very much appreciate that. If there is somebody that does not have access to the chats, you can raise your hand, and we would be able to answer your questions. It's really helpful to have them in the chat for our records and transcription. But if there's somebody that just does not have access, we are able to have a hand raise as well. We've got a question here. If we contract out the training piece but provide placement for participants, can we still apply as lead applicants? DHCS indicated otherwise in past rounds.
This is Clinton here. I guess if it's possible, a DHCS makes an allowance for it, where we might be open to such a thing. But I was under the same understanding too that they don't, and so at the moment I think the answer is no to that. But remember, if DHCS says otherwise, though, that might be a different situation. But I had that same understanding too. So best I could tell, the answer is no still.
Thank you, Clinton. And then we'll take that question back to our leadership and try to get a response for you.
All right, thank you. Let's see here. Okay, next one. If agencies apply for less than the 1 million funding, will more agencies be able to be awarded?
It's possible, yes, but remember, it's a competitive process, though, and so what we're looking for is the scoring criteria outlined in the grant guide. So if you're part of an organization that scores very well, scores very high, you'd be more likely to get an award over one that does not. And so if you have multiple organizations who have like the same score, it might make a difference, because maybe we'd be able to award more organizations if assuming they had the same score, and they're asking for enough money that we can award two of them for and still fit it into our budget. So it's possible, but the main thing I would recommend paying attention to is the scoring criteria outlined in our grant guide. That'll probably be the higher driver of how award recommendations are conducted, rather than how far the money can be splashed about.
All right, thank you for that, Clinton. I saw we've got about 5 minutes left for question and answer. I saw Mike, you raising your hand. Are you having trouble accessing the chat, Mike? You can raise your hand again if you are. I can call on you. All right. All right, you should be able to unmute yourself, Mike.
Yeah, I had a question from what, and maybe it's more of a comment on a few of the other folks' questions on the grading system. It's been our experience that we've been getting a lot of calls from folks that did get awarded grants to do the placements because they're having a hard time placing. And yet, I think they probably, got extra credit points in, being bold and saying 200 or 300 or whatever the number is. But when it comes down to the reality, they haven't been able to meet that expectation, which I think then dings those that are being a little bit more realistic as to what they think they honestly could place in a period of time, because placement has been super difficult, especially if your agencies that didn't get awarded and you're getting called to place. Do you have any comment on that? Because I think in the grading system, it kind of dings folks that are being a little bit more realistic, as opposed to far reaching and say, yeah, we could do 300 or 400. And then when 2 years go by, they haven't met the expectation, but yet got the grant.
Yeah, it has happened. I'm not denying that. But we do have access to the records of organizations that have performed, up to expectations, and then other organizations that have underperformed. I could certainly make our upper management aware of that when they make their award recommendations, but I cannot guarantee that that'll have an impact on the outcome. I'm happy to share with that if that can make a difference. This year, especially, it may be a highly competitive process. It's possible our upper management will be interested in that, but I don't want to promise anything that I can't, because it's anything outside of our grant guide though is I don't want to veer away from that.
Got myself muted there. Thank you, Mike, for that question, and Clinton for that response. We are just about out of time for questions, but we do have time for about one or two more. If anybody has some last questions left, go ahead and get those in the chat. Just want to remind everybody that this webinar is being recorded, and it will be put on our webpage within 7 to 10 business days. And again, you can always email us at bhprograms@hcai.ca.gov with any further questions that you might have. And if there are no other questions today, we can go ahead. Oh, got one in right before the buzzer here. Thank you. You had sent a survey about the placement timeline. Did the requirement change? So 6 months.
This is Clinton here. We have several different surveys out and about right now. from our purposes at HCAI, we do have one that was we do have one, but I think that went for if I'm not mistaken, I believe that survey went out to our regional partners that have a peer program of their own. If you happen to see that, that is a question HCAI is interested in, but it doesn't directly tie to this program.
All right, thank you, Clinton, for that. Okay, let's see here. There are no more questions. I think we'll wrap up our Q&A session. Thank you all for your participation. Great questions, great interaction. We really do appreciate you guys being here with us today. Again, if you have more questions, please email bhprograms@hci.ca.gov. And again, we will be posting this within 7 to 10 business days. For some closing remarks, I'm going to hand it back over to Wahida.
I just wanted to say thank you all for taking the time to joining us and going over all of our detailed information about our programs and especially the peer program and its upcoming funding and current funding. Chris, can you go ahead and go on to the next slide, please? And please follow us on the following social media sites here. And you could click on the scan your QR code and also hashtag us. And next slide. And also sign up for our newsletter here, and I have the link over here, and contact us for any questions regarding your program or your application if you're applying for our next cycle, and we're happy to help you. And next slide. Thank you again for joining us, and we look forward to hearing from you all. And if you have any questions, please email us at bhprograms@hci.ca.gov. Thank you.